In early 2020, the machinery of modern civilization suddenly began to stop. Airports emptied, schools closed, stock markets fell, hospital wards filled with patients struggling to breathe. Billions of people lived under lockdowns or major restrictions on movement. A microscopic virus had brought almost the entire world to a standstill. COVID-19 was more than a medical emergency. It became a dividing line between the world before 2020 and the world that followed. The pandemic transformed how people worked, studied, traveled, shopped, and communicated. It accelerated technologies that might otherwise have taken years to become normal. It exposed weaknesses in hospitals, governments, supply chains, and international institutions. It also revealed deep inequalities. Some people could remain inside comfortable homes and continue working online. Others faced the virus in hospitals, supermarkets, and public transport. For most of the global workforce, however, working from home was never an option. To understand how COVID-19 changed the world, we must return to the final days of 2019. On December 31, 2019, Chinese authorities reported a cluster of pneumonia cases of unknown cause in Wuhan to the World Health Organization. Doctors were confronting an illness they did not yet fully understand. Patients developed fever, coughing, fatigue, and breathing difficulties. Some became critically ill. Chinese authorities identified a novel coronavirus, and researchers released its genetic sequence in January 2020. The virus was later named SARS-CoV-2. Wuhan was a major center of industry and transport, connected by railway and air travel to cities across China and beyond. The outbreak emerged shortly before the Lunar New Year. On January 23, 2020, authorities suspended public transport and severely restricted movement into and out of Wuhan. But the virus had already begun traveling beyond the city. Modern globalization had created a world in which people and products could cross continents within hours. The virus used those same networks. Cases appeared in Thailand, Japan, South Korea, Europe, the Middle East, and North America. On January 30, 2020, the World Health Organization declared the outbreak a public health emergency of international concern. During February, severe outbreaks developed in northern Italy and Iran. Hospitals filled rapidly, and communities entered quarantine. Public gatherings were cancelled. On March 11th, World Health Organization characterized COVID-19 as a pandemic. Animated infection maps became a daily feature of television news. Borders closed. Flights disappeared. A world built around movement suddenly became afraid of movement itself. In March 2020, many governments began introducing restrictions unprecedented in modern peacetime. Citizens were instructed to remain at home. Schools, offices, restaurants, cinemas, and places of worship closed. International tourism collapsed. Some of the busiest locations on Earth became almost unrecognizable. The restrictions were intended to slow transmission, but they also transformed homes into offices and classrooms. The experience was never equal. Some had stable jobs and outdoor space. Others lost income or lived in crowded housing. The pandemic placed essential workers at the center of public life. People whose labor had often been overlooked were suddenly keeping society functioning. The most devastating scenes unfolded inside hospitals and care homes. Doctors and nurses faced waves of patients with severe respiratory illness. Intensive care units ran short of capacity. Some healthcare workers were forced to reuse masks or other protective equipment during periods of severe shortage. Many patients died without relatives beside them. At the beginning of the crisis, medical knowledge was limited. Guidance changed as scientists learned more. It showed how science responds to a new disease, through evidence, testing, and revision. The crisis revealed that advanced healthcare systems were not always resilient. Routine operations and appointments were delayed. COVID-19 damaged health both directly and by disrupting care. While hospitals fought to save lives, scientists began one of the fastest vaccine development efforts in history. The virus's genetic sequence was shared in January 2020. Several technologies were pursued at once. Messenger RNA vaccines delivered temporary instructions to cells. These prompted an immune response without entering the cell nucleus or altering human DNA. The speed appeared revolutionary, but the science had begun decades earlier. On December 2, 2020, the United Kingdom authorized the Pfizer-BioNTech vaccine for temporary supply. Its national vaccination program began 6 days later. Other regulators soon followed. Large clinical trials recruited tens of thousands. The first injections became symbols of hope, but distribution exposed global inequality. Wealthier countries secured early supplies, while many poorer nations waited. Scientific achievement did not guarantee equal access. The economic impact was immediate. Factories closed, restaurants lost customers, airlines grounded their fleets. Financial markets fell sharply. Governments introduced emergency programs, including wage support and business loans. The International Labour Organization estimated that global working hours in 2020 fell by 8.8% relative to late 2019, the equivalent of the annual working time of 255 million full-time workers. The losses were uneven. Office employees often worked remotely, while many workers in tourism, hospitality and retail lost jobs or income. At the same time, online services and delivery expanded rapidly. The economy was being reorganized. Before 2020, remote work was often an experiment. During lockdown, it became a necessity. Meetings moved to video calls, spare rooms became offices, kitchen tables became classrooms. It created isolation and blurred boundaries between professional and private life. Medical consultations moved online. Remote and hybrid work became lasting features of many industries and countries. Online shopping and contactless payments expanded rapidly. Changes that might have taken years happened within months. At the peak of the disruption, more than 1.6 billion learners in over 190 countries were out of school. Education was disrupted for millions. Teachers attempted to recreate classrooms through video calls and digital worksheets. For some, online learning provided continuity. For others, it exposed a vast digital divide. Many schools also provide more than teaching. They offer protection, routine, and access to support services. When classrooms closed, these systems disappeared. COVID-19 transformed political debate. Many governments gained extraordinary powers to restrict movement. In many countries, public health decisions became linked to political identity. Arguments over masks, vaccines, and school closures divided families and communities. Social media rapidly spread both reliable information and false claims. The pandemic also changed social rituals. Weddings were postponed. Funerals were watched through screens. Mask wearing became symbols of responsibility to some and government control to others. It was a shared emergency, but never a shared experience. The key turning point came with mass vaccination in 2021. But vaccination did not bring an immediate end to the crisis. The Delta and Omicron variants caused further waves, and countries lifted restrictions at different times. Governments gradually shifted toward managing an enduring disease. On May 5, 2023, World Health Organization ended the international emergency designation, while emphasizing that COVID-19 remained an ongoing health issue. The emergency faded unevenly, country by country, and restriction by restriction. The designated end of the emergency did not mean the virus had disappeared. COVID-19 left behind a world that was more digital and more conscious of risk. Remote and hybrid work remained common in many industries. Telemedicine, home delivery, and online meetings became ordinary parts of life. Governments and businesses reconsidered supply chains and indoor air quality. Scientific innovation accelerated, but the scars remain. World Health Organization estimated approximately 14.9 million excess deaths associated directly or indirectly with the pandemic during 2020 and 2021. Education was disrupted, and long COVID left many people with persistent symptoms. The pandemic demonstrated that modern society was both powerful and fragile. Humanity identified a new virus, decoded its genome, and developed vaccines within months. But access to safety still depended heavily on wealth, housing, and geography. The pandemic did not create every transformation that followed. Many were already beginning. But COVID-19 brought the future forward. The world that emerged was not entirely new. It was the old world, accelerated, exposed, and permanently altered. COVID-19 became one of the defining events of the 21st century, and its effects continue to shape our modern world.